Hello, and welcome to the Center for Optimizing Rural Health's monthly webinar. Our topic today is HIPAA in 2021, an overview and updates presented by Misty Carter. Misty is the Director of Research at the Texas A&M Rural and Community Health Institute at Texas A&M University. Thank you for joining us. I am Cassidy Avila, and I will be moderating the webinar today. I do have a couple of notes for you just before we jump in. First, all participants are muted, but we do welcome and encourage questions. You may type them into the chat as they come to you or wait until the end of Ms. Carter's presentation. But either way, we will be sure to address them at the end of the presentation during the Q&A session. We are recording this presentation and we will make the slides available to you as well as the link to this recording sometime this week once it goes up on the core website. It is now my pleasure to introduce our speaker to you, Misty Carter. Misty earned her law degree from the University of Texas in 2003. She's worked at Texas State University, St. Edward's University, and the University of Texas's McCombs School of Business. She began working for Texas A&M University at the Mace Business School in 2008 before moving over to the College of Medicine in 2012. She took a year off to pursue her PhD in communication and graduated in December 2015 from Texas A&M University's College of Liberal Arts. Misty has worked to develop a communication skills assessment and help develop and deliver the professionalism course for medical students at Texas A&M. She has also been a course director in the Department of Humanities for becoming a physician for both the Bryan and Temple campuses. Misty has a strong background in corporate law, academics, and communication. Welcome, Misty. Thank you so much for being here with us today, and we're looking forward to your presentation.
Thank you so much, Cassidy. So thank y'all for joining us today. I know HIPAA can be somewhat of a dry topic, but I want to make sure that we have time for some interaction and questions. So please, if you have a burning question, go ahead and type it in the chat as we go, or I think you can use your raise hand feature. I've got a big screen, so hopefully I'll catch it, or Cassidy is welcome to pause me at any time. So as Cassidy said, I started my career in law and then moved into academics and focused on healthcare and communication. And so HIPAA is something that I have watched evolve through my legal career. And so we'll talk a little bit about that as we're walking through the overview and background, because it's one of the few areas of law where breach is presumed, right? So we'll talk about that. Our overall objectives today are to talk about HIPAA, the provisions for HIPAA in the federal level, and the Texas rules that correspond to that. We'll also talk about the HIPAA updates for telehealth and COVID. I'm sure you all are monitoring that day to day and making sure you're complying there. And finally, we'll talk about recent examples of HIPAA violations and the related fines. So I always like to start when I'm talking about HIPAA just stepping back and saying, what are those basic legal concepts that we're reflecting on here? There's a difference between privacy and confidentiality. So privacy is something that I think we all have a sense of. I know it sounds like it should be a fundamental or constitutional right. It's actually not in the Constitution. It's part of the penumbra of rights, that umbrella of rights that is developed from the Constitution itself and the case law that developed after. So there are a lot of cases about privacy and what it means. And the broadest term, when we're talking about privacy, there are four basic areas of privacy. And these also kind of bleed over into why we have HIPAA and how it works. So we're talking about privacy, physical seclusion, or being able to be on your own and not have somebody tell you where to be is one of those basic rights. We also have protection of personal information, protection of your personal identity, and ability to make choices without interference. So some of the examples I used to talk about in basic business law are, for instance, Arnold Schwarzenegger. His name and likeness was used before he was governor. Of course, he was the Terminator. Some car dealership in California was using his name and likeness, and I'll be back, right? We'll be back with deals, something of that nature. And he sued successfully, saying that is my personal identity. That's who I am. Now, of course, there's exceptions when we're talking about people who are public figures in some instances. But this idea of privacy and you have a right to privacy is really basic. I oftentimes talk to my students also about, well, do you have a right to privacy if you're standing out in the open? So for instance, after class one day, I heard some students talking about what their plans were for the weekend. I didn't talk about those students specifically the next week in class, but I said, if you're in a public space, do you have an expectation of privacy? Probably not, right? Because you're not in a private place. So all of those concepts are very basic in the law, and something that we'll talk about with HIPAA specifically. As HIPAA came about, what are we trying to protect here? Now, confidentiality is a narrower concept. It refers to protection in a specific context, right? So you might have attorney-client privilege. That's a very specific confidential privilege or privacy right. When we're talking about it in a medical context, we have a duty not to disclose information. And that is included at the state level when we're talking about state rules regarding medical practice. So it's something that is written in the statutes that you have to keep things confidential. So we already had all of those pieces in place when HIPAA was developed and passed in 2000. So let's talk about the acronyms for HIPAA. I'm sure if you're tuning in today, you are probably well versed in these acronyms. So I won't spend a lot of time here. I just want to make sure we're all using the same vocabulary. When you see it on the slides, CE is a covered entity. PHI is protected health information. We'll talk about that specifically in a moment. TPO, treatment, payment, healthcare operations. EHR or EMR, electronic health record or electronic medical record. HHS, the U.S. Department of Health and Human Services, the secretary. So that's at the federal level. HHSC is at the state level. So we're here in Texas, so we'll focus on the Texas rules. The Texas Health and Human Services Commission, or the Commission. Then we also have the Texas Health Services Authority, THSA. Now, I make mention of that because they are responsible for coordinating the implementation of health information exchange in Texas. They were created in 2007 by the Texas legislature as a public-private partnership and legally structured as a nonprofit to support the improvement of Texas healthcare system by promoting and coordinating HIE and health information technology throughout the state to ensure the right information is available to the right healthcare providers at the right times. So they're a place that is a great resource. I'm sure you might be familiar with them. When we talk about breach and mitigating breach, there are some call outs to say if you or following their rules and doing your best to comply there, that can be a place for mitigation of breach when you're in Texas. So I just wanted to mention them specifically. And then the AG, or Texas Attorney General, that is the authority when we're talking about the rules in Texas, when we're talking about privacy and HIPAA. So I just want to walk through the basics when we're talking about HIPAA. What do we mean when we're talking about these different rules? Because when we're talking about compliance and breach and what the fines are at the end of our time together, there's reference back to which rules are being violated. So let's talk through the HIPAA rules. There are 4 basic rules when we're talking about HIPAA. The first rule here is the privacy rule. So that was the rule that was originally passed in December of 2000 and then modified in August of 2002. It set the standards regarding how we use and disclose PHI. So when I'm doing this talk in person, we're starting with privacy and what it means. I think pretty much everybody agrees the idea of keeping records private is important. And that's something that everybody strives to do. It's that the privacy rule really put in these specific standards about how that was going to work. All PHI is covered by the privacy rule. The security rule, it was passed next. That came into play in February of 2003, and that protects electronic, or ePHI, electronic protected health information. It's required that covered entities and their business associates use this and make sure they have met the security rule to ensure that all ePHI, is secure. Then we had 2 rules passed together as part of HITECH. So these two things taken together is what we sometimes refer to as the high-tech rules: breach notification rule and the enforcement rule. So the original rules here were passed in 2003, and they were passed in a series through 2009. And so as an attorney watching these rules coming into play, you can see that we had the privacy and security rules at first. And a lot of attorneys would go to conferences and say, well, these are nice ideas, and we're told we need to put these rules into place and have a plan, a security plan. But there wasn't a lot of enforcement, and there wasn't teeth, for lack of a better word, if you didn't do what was called for in the privacy and security rule. In 2013, they passed the HIPAA omnibus rule, or the final rule, that modified these first 4 HIPAA rules and gave more detail. So everything that we're talking about today is 2013 forward. It's all included. So I'm not really calling out those distinctions anymore. But as it evolved through the legal side of things, it was an interesting area of law to watch, because the privacy and security rules came in first, and then we didn't have breach and enforcement until later. So when we talk about the fines, those are all just within the last 10, 11 years that we've had fines associated with HIPAA compliance. So we're going to take a closer look at the first 2 rules to start with. The first rule, the privacy rule, as I mentioned, establishes rules to protect all PHI, or protected health information. De-identified information is not protected. So let's just unpack a little bit what PHI is. If you're here today, I'm sure you're very familiar with PHI. It's all individually identifiable health information held or transmitted by a covered entity or its business associate in any form or media, whether electronic, paper, or oral. So when we're talking about protecting PHI, that's why I made mention of having a discussion outside in a medical context, having a discussion in the elevator or in the hallway. Oral discussions of protected health information count and are covered when we are talking about what is protected health information under this privacy rule. So all of these rules apply. The full list of all 18 items are included here. Again, names, dates, telephone numbers, geographic data, fax numbers, email, social security, all of that is included. Now, I did mention at the top, it's for anything that is identified. So de-identified information is not protected. I just mentioned that in a research context, there is a way to clean the data to use it. For research purposes, I would just caution you to make sure that you are adequately cleaning data before you call it de-identified. So I will leave that to the experts who really focus on that area. This privacy rule, as we mentioned, applies to covered entities and business associates. Now, the definition of covered entities is health plans, healthcare clearinghouses, healthcare providers. It applies to business associates directly. It used to be an indirect application, and that would include individuals or entities acting on behalf of a covered entity. So the real meat of this rule is in bullet 3. Covered entities and business associates may not use or disclose protected information unless it is for treatment, payment, or healthcare operations, or there's a requested disclosure. So when we're talking about those permitted uses, treatment, of course, is any coordination, management of healthcare, provision of healthcare. Payment is eligibility of coverage or billing and collection activities. Other healthcare operations would include quality assessment, medical review, legal auditing services, things of that nature. The real key here is following the principle of minimum necessary use and disclosure. So that means you have to make reasonable efforts to use and disclose only the minimum amount of information, or PHI, that is needed to accomplish the task you're trying to accomplish. So again, all of this, when you unpack it, makes sense. It's just we have to make sure we're meeting the requirements as it's laid out in the federal rules here. Finally, at the bottom, we have two additional bullets. One is the gives rights to the patients, gives them rights to their PHI. So rights of the individuals being able to get their medical records. We're going to talk about this in a moment. It's something that the HHS has really been focusing on in the last probably 2 years, I guess. It looks like the first case was in 2019. this right of access initiative. So when we talk about compliance, there have been 16 different organizations that have been fined for non-compliance with this right to access for patients. So the OCR, the Office of Civil Rights, which is the enforcement agency for HIPAA, has really focused on giving patients, rights to their medical records. And with that initiative has found at least 16 that I'm aware of instances where there have been fines levied against organizations for not meeting that right to access. So we'll review a couple of those when we look at current violations. And finally, we have this required notice, or requires notice to patients about those rights. So that notice has to talk about how the entity may or may not use and disclose PHI, the legal duties and responsibilities of the organization to maintain the PHI. So all of those items that have to go in notice must be met. So that's something to pay particular attention to make sure your notice is up to date and meets those requirements. The second rule we talked about was the security rule that applies to ePHI. I don't spend a lot of time here because this has become highly technical about what type of servers and protection you should have. We have a person here at Archie who is an expert, Dr. Peter Yu, and he can tell you with much more detail what those standards are when it comes to servers, computers, et cetera. But the goal is to protect the confidentiality, integrity, and availability of the electronic PHI. So a lot of the breaches we see when it comes to HIPAA are in this area, meaning that there's been some kind of a disclosure that happened that shouldn't have online. There's one of the first disclosures that became a security rule breach or violation was several years ago when there were two large organizations who were changing servers over, and one of them was left open on the World Wide Web for a few minutes, and a hacker was able to get in and get information out. The security rule does cover not only those technical safeguards, but if you look at the second major bullet point here, it also covers administrative safeguards and physical safeguards that are related to ePHI. So for instance, the administrative safeguards would be if someone is fired or no longer working for your organization, his or her password and information is cut off immediately upon their disassociation with the organization. That would be something that would be administrative. The technical, again, I defer to people who are much more versed than I am in these technical realms. And then finally, the physical safeguard would be locking things overnight, making sure laptops are secured, making sure that anything that is has ePHI on it is physically safe and put away. Administrative, you could go back also there to say you could have rules about who can check out a laptop. If you have a flash drive, how does it protect it? So those are the things that work in tandem in these three areas to make sure that we're keeping information safe. It is important to note that when the HHS put this rule into place, it really says that you've got to look at what kind of organization you're in, right? And so given the healthcare marketplace is diverse, there's a note here that the security rule is designed to be flexible and scalable. So a covered entity can implement policies, procedures, and technologies that are appropriate for the entity's particular size, organizational structure, and risks to the consumer's ePHI. So that's something that the rules are very scalable, and it's something important to think about is that you need to do an evaluation in your own entity to figure out what would be best and appropriate for you. So now we're going to talk about the Texas rules. The Texas rules have been codified in the Texas Health and Safety Code, Chapter 181. When it came through the legislature, however, it was called House Bill 300. A lot of attorneys still refer to it as House Bill 300, so I just put that in parentheses. It became effective in 2012, and it is broader than HIPAA. So in Texas, we do things a little always bigger, right? And bigger in Texas. The rules here in Texas are a little more stringent. So the four major categories we're going to walk through is the covered entity definition, the new operational requirements, special breach notification rules, and the greater enforcement and increased penalties. So let's look at that. The first area was what counts as a covered entity. So covered entity, as we talked about in the federal rule, is pretty narrow. But here in Texas, if you're a covered entity under HIPAA or under Texas law, you must comply with the Texas Medical Records Privacy Act. So it says here that Texas defines a covered entity as any person who, A, for commercial, financial, professional gain, monetary fees or dues, or on a cooperative, nonprofit, or pro bono basis, engages in whole or in part and with real or constructive knowledge in the practice of assembling, collecting, analyzing, using, evaluating, storing, or transmitting protected health information. The term includes a business associate, healthcare payer, governmental unit, information or computer management entity, school, healthcare or health researcher, healthcare facility, clinic, healthcare provider, or a person who maintains an internet site. So it's a much broader definition than what we see in the federal HIPAA rules. B, we've got, comes into possession of protected health information. C, obtains or stores protected health information. So that would be any business associate that's storing information. And then it is D, an employee, agent, or contractor of a person described above. So anybody who's acting within the course and scope of their business in one of those named, named covered entities above. So it's much broader reach. One attorney actually said in a continuing education, well, does that mean if I just pick up a record that happened to have fallen out of somebody's bag and it's on the ground, does that mean I'm a covered entity? No, probably not. But it just was more to the point of it just seems very broad. I see a question in the chat about requests, phone calls, when's a good time to report this clinic for not sending records. So we'll talk about that in just a moment on how long you have to send records and the timing of that. So that's a great question. Thank you, Laura. Okay, so let's walk through this and then we'll look through, I actually think it's coming up in just a moment on the timing of how long. Covered entities, this is notice, must provide individuals with a general notice that the individual's PHI may be electronically disclosed. So this is on top of the notice of the procedures we talked about under HIPAA. So HIPAA requires that you explain to patients how you're keeping records, how everything is kept private. This is an additional notice required here in Texas that you have to let people know that their information may be electronically disclosed. It can be provided in any of these ways, posted on the place of business, on the website, or any other place the individual is likely to see the notice. So here's an example that is included, is just required notice. Here's what we want to make sure we let you know. So when we're talking about authorization, we mentioned under HIPAA, you can't use this information or give it away unless there is an authorization or request. So the general rule is covered entities may not electronically disclose PHI to any person without a separate authorization from the individual or the individual's legally authorized representative for each disclosure. It says here that the authorization may be given in writing, electronically, or verbally, and that verbal authorization must be documented in writing in by the covered entity. So I discourage the verbal. So I would make sure you have a written authorization of some sort. Exceptions, again, are the disclosures made to another covered entity for treatment, payment, healthcare operations like we've talked about, or for performing an insurance or HMO function, or otherwise required by state or federal law. So that's part of what we're talking about now with COVID disclosures and COVID testing disclosures. There are rules in place that you can disclose information under the state rules and federal. Here's an example authorization, and I've got a link on the bottom of the page of where you can find that authorization. Final note, there is some discussion when we're talking about covered entities and definitions. Just a note, that doesn't include the Texas Insurance Code section 602, right? It doesn't cover that portion. I just wanted to make mention of that. It's brought to light in the rules here in Texas that that's not the same meaning as what we call covered entity in quotes under the Texas Insurance Code. So training and making sure that patients have access to their records are the final two pieces here. When we're talking about training, Texas requires that covered entities train their employees on state and federal law concerning PHI as necessary and appropriate for the employees to carry out their duties for that covered entity. So again, when we're talking about HIPAA, it is all what is specific to your job and your entity. It's very scalable and focused on what is important to your particular institution. The timing, Texas requires that training must be completed within 90 days of hiring. Just a note here, when this was going through the legislature, sure, it was just 60 days. Should we make it shorter or longer? And so 90 days is what the final rule is. Material changes in state or federal law, if those come about, the employee must have training within 1 year of the date of the material change taking effect. Now, at the federal level, this is what they say at HHS. It's industry best practice to suggest the entire workforce should be trained at least once every year. And anytime your practice changes its policies or procedures, systems, location, infrastructure, et cetera. So again, there's a lot put back on the institution to do what is appropriate for that institution. Okay. For the proof, employees must sign a verification electronically or in writing to show that they completed the training. The covered entity should keep that for at least 6 years. So that's the verification that is required. Okay. So when we're talking about the disclosures, again, the general rule is that the covered entity may not disclose PHI for payment. Exceptions, again, are treatment, payment, or healthcare operations, performing an insurance or HMO function, or as otherwise authorized or required by state or federal law. There's a note here that direct or indirect payments may not exceed the covered entity's reasonable cost for preparing or transmitting that PHI. So there used to be a lot of copy fees. I don't know if you guys are still doing printout or copy fees. Typically everything is electronic now. I remember getting records for one of my children who is now 12, and there was a pretty large copy fee, but that was to get making sure I had different pieces and scans and things of that nature. So you can have a nominal fee to get records. This goes to that question of how long do you have? I think that Laura was asking. Offices have 15 business days to provide electronic records. The federal rule is 30. So this is, again, where we've seen 16 cases in the last 2 years of making sure patients have access to their records. If the office is using an EHR system that is capable of fulfilling the request, this is the rule. There are some exceptions if their records are old and they're off-site, right? You have to go out and get them. So I, again, would ask you to look at those specific rules if you have, if you're filling these requests. The person sends a written request and can agree to accept another form or format, but that would have to be the patient would agree to accept another format. Exceptions, federal exceptions apply in Texas. So Texas says refer to the federal exceptions for the release of PHI under HIPAA. And so those exceptions would be for psychotherapy notes, for instance, can be kept from patients. The second exception is information compiled in a reasonable anticipation of or for use in a civil, criminal, or administrative action or proceeding. So if there's a court order that says we're not releasing these records for some reason, then that would be the exceptions that we're referring to here. The standard electronic format could be recommended, and that's again where we're talking about health information exchanges or HIE in Texas, trying to make sure we are all on the same page when it comes to medical records. Finally, when we were talking about Texas, I just wanted to make sure you all were familiar with the consumer website. And there was a question about reporting. The consumer website is run through the Attorney General's office here in Texas. That is the office that is tasked with enforcing the Texas Medical Privacy Act. And the website is pretty robust. You can see here we've got patient privacy, healthcare fraud and abuse. So that patient privacy is the HIPAA equivalent for us here in Texas. You can click on it and get a lot of information. There's also a place to file a complaint online. When the question was about sending information over, that's a really good question when we're talking about a clinical setting, because typically what I'm seeing in the literature that's coming, or I should say the notices that are coming from the Office of Civil Rights, is that it is a patient right of access. I haven't noticed a situation where it's a provider requesting records that files the complaint. So it might need to be a patient, since this is a patient protection act, the patient, him or herself, letting the authorities know that there's some delay in providing medical records. Okay, so when we're talking about auditing, this is the last slide. When we're talking about Texas, I just wanted to make mention that Texas does include in the privacy rules the right to audit. I'm not familiar with the AG's office doing auditing here. And again, I just wanted to make you aware of the provisions that if Texas has evidence that a covered entity has committed a violation that is egregious and constitute a pattern, they may require that covered entity to perform and submit a risk analysis, or may alternatively refer the covered entity to a licensing agency such as the Texas Medical Board for an audit. Now, even though we're not seeing this at the state level, the federal level has been doing HIPAA audits for quite some time. My understanding is they started doing them robustly in July of 2016. Now, because of COVID, I don't know that they're doing as much auditing right now, but that is something that they were doing back in 2016 forward. Okay, so let's talk about breach. Let me check the chat. You can talk to me more about the Cures Act. A hospital is not in our network. Can you call and ask for records without the written authorization? So I always say I'm not providing legal advice when we are talking about what's the best way to do it. So let's return to this at the end when we're talking about what's the best way to do it. The rule under the privacy and security rules are you can exchange information about a patient for the treatment, payment, or operations when we're talking about medical provisions. So I actually years ago pulled a question and answer. I don't know if it's still on the website for OCR. It said, does a physician need a patient's written authorization to send a copy of the patient's medical record to a specialist or other healthcare provider who will treat that patient? The answer was no. The HIPAA privacy rule permits healthcare provider to disclose protected health information without the individual's authorization to another healthcare provider for that provider's treatment of the individual. However, I say I want to make sure you check your local listings, because you might have policies and procedures in place that require that for your organization. Okay, so let's talk about breach notification. Remember at the beginning, we said that there weren't really teeth. We had the privacy and security rules, and then when breach notification and enforcement rule came into effect, that's when we started having rules about what happens if there's a HIPAA breach. The definition of breach when we're talking about the federal level is the acquisition, access, use, or disclosure of PHI in a manner that's not permitted, which compromises the security or privacy of the PHI. So when we're doing a breach analysis, this is the most important part, I think, here is the breach is presumed unless the covered entity or the business associate can prove that there is a low probability that PHI has been compromised based on a risk assessment that's 4 parts. So this is one of the few areas of law where you're presumed guilty, for lack of a better word, right? I mean, we're all familiar with the you are presumed innocent until proven guilty, right, in criminal situations. But here, breach or a breach of some sort is presumed. And then you have to show that you didn't have a breach. But to show that, you have to show that there's been a low probability that it's been compromised, and you have to do this risk assessment. Let's look at the risk assessment. First, the type or nature and extent of the PHI. So that would mean, what kind of PHI was it? Is it electronic? How many records were affected? Was it paper? What happened? Who was the unauthorized person involved? Was it a former employee? Was it someone else in the hospital or the system? Was it someone else that was it a hacker, someone outside the system? The third is whether the PHI was actually acquired or viewed. So is there some way that you can tell if the information has been accessed? So is there a program in the electronic world that can let you know, yeah, that was open or viewed by someone? And finally, number 4 is the extent to which any risk has been mitigated, excuse me. So I used to work in the employer world, and risk mitigation was really important when you were talking about employees, right? I always used to say, you can't control what people are doing all the time, but you can control what you as an organization do in response. So that's that's why we talk about making sure you've done a risk assessment and you're ready for any sort of breach. And then if something happens, what did you do to mitigate it? So when attorneys who practice in this area look at this breach analysis, I've heard in a continuing education, doing this analysis takes time, and the requirement to turn yourself in, for lack of a better word, or notify OCR of a breach is pretty short. So most of the time attorneys say you should go ahead and report and then do the analysis. So let's look at those timeframes. The notification rules of a breach, and again, it's presumed, right, is you have to notify the individuals within 60 days of the breach. HHS, the secretary, and that would be the Office of Civil Rights, needs to be notified within 60 days if there are more than 500 individuals who are affected. If there are less than 500 affected, then you can just do it yearly with your annual reporting. For media, if you have more than 500 individuals affected, you have to alert the media within 60 days. Now, how this reporting works, I will ask you to go through those details on your own. If you have a breach, contact somebody that can help you work through this, because the rules are very specific. So when we're talking about contacting individuals, for instance, you have to do so by mail. It could be by email if they've given you the right to contact them by email. But if you have a certain number that bounce back or don't have correct email addresses, then you have to choose an alternative way of notifying them. So I, again, suggest finding somebody who is an expert in these areas to help with all of those pieces. When we're talking about the media, then there's certain rules there, right? What kind of media outlet should it be? Should it be somebody, again, it says something to the effect of required to provide notice to prominent media outlets serving that state or jurisdiction. So it would depend on where you are as to what counts as media. So I would, again, tell you, this is very factually specific. Make sure you have someone helping along the way. Now in Texas, we don't focus on this a lot because, again, Texas typically says refer to and comply with the federal law. I did want to mention that in Texas, any issue when it comes to a breach, a HIPAA breach, is covered by the Identity Theft Enforcement and Protection Act, so ITEP. ITEP says you must protect SPI or sensitive personal information, such as name, social security number, driver's license, etc., or PHI. So PHI is referred to here. This is under the Texas Business and Commerce Code and was really passed in reaction to hacking and cybersecurity altogether that occurred in the 2000s. This went into effect in 2009 and was really about identity theft, and PHI is included in that. And it applies to any person who conducts business in the state, owns or licenses computer data. So it would be anybody operating in Texas, this would apply. If a breach occurs, the person conducting business must disclose the breach to any individual whose SPI was or is reasonably believed to have been acquired by an unauthorized person. Notification should be made quickly as possible unless law enforcement requests a delay. So that, again, is basically you want to be in compliance with HIPAA, and so there's no specific time frame in Texas that would make that any more stringent. So now let's talk about the enforcement, and I'll walk you through some of the latest enforcement fines that have been levied. When we're looking at HIPAA violations, this is what the Office of Civil Rights has provided as a guideline as to what kinds of civil penalties and related fines could be levied against a covered entity or business associate. So if you look at tier 1, it really is a situation where you're unaware that there's been a HIPAA violation and that by exercising reasonable diligence, you would not have known that the HIPAA rules were being violated. That in legal parlance is really more saying you couldn't have known, right? Somebody was a very sophisticated hacker, got through the system, and you did not know they were there, and you were unaware. And even if you had looked, right, by exercising reasonable diligence, you wouldn't have known because it was a very slick situation, or someone was a very good con artist and nobody would have known. So that's a tier 1 violation, which is 100 to 50,000 per violation. Then when you go to the next tier, this is where you didn't know, but if you had looked, you would have known. So this is reasonable cause that the covered entity knew about or should have known about the violation. So this would be something that was pretty obvious. So let's say, for instance, your computer system continues to crash day to day, and you're thinking, somebody could have hacked in here, but you decide not to investigate. You should have known, right, that something was going on. Similarly, if you have an employee, for instance, that is acting in a strange manner and you might need to ask what's going on, something of that nature, that might be a tier 2 violation. So the listing here or associated fine here is 1,000 to 50,000. Then we go to tier 3 and 4. So both of these are related when it comes to sort of the causation underlying it. Tier 3 is there was willful neglect. So that means you had a knowing indifference is another way we say it. You knew something was going on, but you didn't stop it. On tier 3, if you knew about it and then corrected it within 30 days of discovery, you have a $10,000 to $50,000 per violation associated fine. Tier 4 is willful neglect of the rules, and then no effort was made to correct those violations within 30 days of discovery. So you think that wouldn't happen, but we'll talk about in a moment just a couple of cases where things went on, and if you ignore a HIPAA violation, then you could fall under tier 2. We also have the maximum violations around the edges. Now, I want to mention Texas has its own rules as well. Again, my understanding is Texas and the Attorney General here has not focused on really prosecuting these. It's been that second line of defense, which was turn it over to the Texas Medical Board or other reporting agencies. So my understanding is here in Texas, we haven't had a lot of activity around the enforcement. However, I just want to make mention that that is a possibility. My understanding is HIPAA rules and Texas rules can be enforced concurrently. So that's just something to know that they're on the books, and that is something that is as available for the Texas Attorney General's office to pursue. Now, if you look on the right, I did want to mention there is this mitigating at the bottom for the Texas House Bill 300. That's what I made mention at the beginning about using the THSA to mitigate THSA, I just want to make sure I said the right acronym, thank you, that if you are complying with their rules, that can contribute to mitigating those factors. So I just wanted to make mention there. Okay, so let's talk through some recent examples. I've listed here just a website. This is through the OCR portal. You can see the attachment at the bottom, ocrportal.hhs.gov. This is the place that lists all of the ongoing, as you can see, cases currently under investigation, ongoing investigations for the last 24 months. So for instance, I went this morning and did a search for Texas. So right now in Texas, there are 59 ongoing cases that have been ongoing or reported within the last 24 months. So this is a list of recent HIPAA violations. I mentioned at the very beginning this right to access, and that's something that's been going on again since 2019 as organizations, or that OCR is saying organizations need to be more responsive to patients. So there have been 16 cases. Bayfront was the first. And that was a breach when a organization did not provide an expectant mother her records for her unborn child within that 30 days. So that was the first example. And then the most recent example, which we got word of the fine on February 12th of 2021. So these are continuing even through COVID, was Sharp Healthcare. So Sharp did not provide medical records back in a timely fashion. And that it says the complaint here was filed that patients' records were supposed to be directed to a third party. So this is answering the question earlier about filing on behalf of a patient. So my understanding here is the patient said, I've directed my records to go to a third party. It didn't happen. And so OCR fined Sharp Healthcare for that. So what I was going to ask you guys to do is, what do you think the fine would be? We just looked at our list of available fines. I will make mention that unlike sentencing guidelines in criminal cases, OCR, when fines are levied against organizations for HIPAA violations, do not tell specifically in their bulletins what type of violation it was, tier 1, 2, 3, or 4, right? So we don't really know which type of tier they're in. So when we're talking about fines, what do you think, if you just type in the chat, would be an appropriate fine for failure to give access to records? Maybe I'm not seeing anything in the chat. I thought, could you type in something in the chat? Like, what do you think would be appropriate for a fine? Here we go, 500,000. Okay, we'll do this with more. So it really varied here. It ranged from 3,500 to 200,000, depending on the size of the organization and how long it took them to respond to the patient's request. Okay, so let's talk through a few more of these. Exelis Healthcare Plan was an organization that had cyber attackers. So they reported in 2015 that they had cyber attackers that had gained unauthorized access to information technology systems. They said that the breach began on December 23rd of 2013 and extended until May 11th of 2015. So it's 1.5 years. The hackers installed malware and conducted reconnaissance activities that ultimately resulted in the impermissible disclosure of PHI for more than 9.3 million individuals. Okay, so this is a big healthcare plan, a health services corporation that provides coverage to over 1.5 million people in upstate and Western New York. What fine do you think would be appropriate here? Okay, $1 million. Thank you, Laura. 5.1 million. So that was a pretty big fine when we're talking about a cyber attack. In reaction, OCR said hacking continues to be a great threat and that you have to make sure you have enterprise-wide risk analysis. Upon investigation, they found there was not an enterprise-wide risk analysis, and there was a failure to implement risk management information system activity review and access controls. City Health Department, this is in New Haven. This was a situation where an employee who had been fired or left, just says former, a former employee returned to the health department 8 days after being terminated and logged into her old computer with her still active username and password to download PHI that included patient names, addresses, dates of birth, etc., and put them on a USB drive. Her ID and password had been shared with an intern who continued to use that information after the employee had left. What was the fine? She accessed 498 people. Fine here, $202,000, $202,400. Next is Aetna. There were 3 major breaches here. One was a situation where There were websites that were used to display plan-related documents, and they allowed them to be accessible without login credentials, and they were available. Basically, you could see what plans people were subscribing to. That was 5,000, excuse me, and 2 individuals. Then we had a second breach where they mailed out notices about who was receiving medication, and it had the words, quote, HIV medication, end quote, that could be seen through the envelope window. So that was the 11,887 individuals. And then finally, there was a breach that was submitted that had the name and logo of a irregular heartbeat research study and said what the people were participating in that irregular heartbeat study. So that was 1,600 individuals. So what would be the cost, you think, for that fine? I see we've got tier 2, maybe. They don't tell us what tier, but that ended up being $1 million fine. So next we have a few cyber attacks. The one I wanted to talk about was CHSPSC. That is a situation that they provide business associate services, I should say, out of Franklin, Tennessee. They were actually contacted by the FBI, that the FBI had traced some cyber hackers to them. And despite that notice, the hackers continue to access and exfiltrate protected health information of 6 million plus individuals for, looks like, about 6 months. The OCR found upon investigation long-standing and systematic non-compliance with the security rules under HIPAA. So because of that non-compliance and FBI gets involved, what do you think here? Bigger fine, smaller fine? Much bigger, 2.3 million. And then we have a lot of individuals that are affected. So if the FBI gets involved, you better react swiftly. Finally, there are a couple more cyber attacks I just wanted to mention. This one in Athens Orthopedic, a journalist got involved because a journalist found that he or she could see information online, and the Athens Orthopedic didn't take action, and those patients were exposed essentially. If you should have known, then it's going to be a higher number. So that's 1.5 million. Blue Cross, I just wanted to mention this one. This was 6.85 million. This was the second largest fine levied against an entity. And of course, Primera Blue Cross is a huge entity. What happened there is cyber attackers gained access to the system, and it went on unprotected and undetected for nearly 9 months. So that's something to pay attention to as well. Finally on here, I just wanted to make mention of a couple more. Lifespan, this was a stolen laptop that was taken away. When they did an investigation, there was systematic non-compliance. So you can't just have a plan, you've got to have rules in place, and they have to be discussed and enforced. Dr. Porter, I just wanted to make mention of this one. It's a very small organization. He got into a dispute with one of his business associates. And my understanding is that Dr. Porter's medical practice filed a breach report on its own. So the medical practice reported a breach of somebody they were working with. And when the OCR came to do an investigation to investigate Dr. Porter's report on somebody else, they found that Dr. Porter actually was not in compliance. He'd never done a risk analysis and then hadn't really put any rules into place to make sure that he was complying with HIPAA. So the others, I'll let you guys check out. I did want to mention this public disclosure on Allergy Associate because it was only one individual. That one individual was a situation where we had a local television station spoke to a patient a local television station wanted to talk to the organization about a patient, and you just cannot talk to anybody about your patients. So the reporter contacted the doctor for comment. The doctor impermissibly disclosed the patient's PHI to the reporter. So you can't have those disclosures. So I just wanted to make mention of that one specifically. So I know we don't have a lot of time left. Let's talk just briefly about what's going on with COVID. and HIPAA. So here are the basics. I've got a link at the bottom of this page and the next one so that you can look these up yourself and read through them. They're lined out very nicely on the link provided. So HIPAA enforcement in COVID, when we're talking about the privacy rule, OCR has sent out a couple of bulletins. This was early on in COVID, that the privacy rule will allow, again, disclosure of PHI for treatment, public health authorities. This does not extend to media outlets. There was discussion at the very beginning of COVID, I guess, that there had been an organization that had let the media in. Masks and having people blacked out or grayed out after the fact is not HIPAA compliant. You have to do that in advance before you let the media in. Telehealth, OCR will not impose penalties for the good faith use of telehealth during COVID. Non-public facing remote communication products can be used. And actually in this bulletin, the 17th and the 20th of March, they go through what's allowed: Apple, FaceTime, Facebook Messenger, Skype, among others. Not allowed Facebook Live, Twitch, and TikTok. So please don't see patients via TikTok. Media access is limited. Again, there was another bulletin for limited media access when we're talking about COVID. Using health information exchanges. So this just came out at the end of last calendar year. HIPAA permits some disclosure of PHI to an HIE or health information exchange for reporting to public health authority engaged in public health activities. And finally, this came out in January, that OCR will not impose penalties for HIPAA violations in connection with the good faith use of online or web-based scheduling applications for COVID vaccines. We had an instance here locally where there was an organization who was doing COVID vaccines, and the person who was coordinating it had a name akin to one of my friends. And my friend said that they're asking me if I'm administering this, and I'm not. I said, oh, and it looked to be just a simple Google form. So HIPAA, OCR has said we are not going to impose any violations if you're making, again, a good faith effort to use some online or web-based scheduling application. So I just point that out. Here in Texas, changes we have amiss due to COVID: telehealth. So phone encounters only may establish a doctor-patient relationship and can be used for continuing care. So I encourage you to look at the March 14th, 2020 update from Texas. The same standard of care and documentation must be used, and you have to follow HIPAA guidance regarding platforms that we just discussed, such as not using TikTok. Last, chronic pain, prescription and refills. The Texas Administrative Code, which is where we house the rules coming from the Texas Medical Board, was being updated over and over, giving emergency relief. And finally, on March 1st of 2021, they put into place Texas Administrative Code 174.5. You can see at the bottom here that basically says we're going to leave this in place until the emergency is over. So what this does is allows telephone refills of certain prescriptions to establish chronic pain patients if the patient has been quote unquote seen in person or using telemedicine, but it has to be audio and video, two-way communication. Okay, so that has to be done within 90 days. So I see that we're at the end of our time. Let me pause there. You all have access to this information. I will turn on my video and see if I can answer or address a couple of these last questions. So it says here, can a patient sue an organization for these violations? Yes, you can have a private right to action. So I like to always make that distinction. It would have to be under something other than HIPAA. So HIPAA is where a patient would report something going on to OCR or the appropriate Texas agency, and then the agency would do an investigation and fine or take whatever actions are appropriate against the organization. A private right of action would be different. So that would be a patient could sue under a state law, right, saying that this was disclosed and that's a violation of, for instance, the rights and duties that are required under the doctor-patient relationship. So that would be different. Other questions? Oh, thank you, May. Okay. So Cassidy, I'll ask if you see other questions.
I don't believe I see any that you have not addressed, but if we did miss your question, just unmute and let us know, or type it again. We'll stay on for just a couple more minutes. And while you're gathering your last thoughts, I did go ahead and include a survey link in the chat. It's about a 60-second survey, a little bit about today's webinar and what you might like to see in the future. So if you have a second, we would appreciate that. And I don't see any other questions coming through in the chat, Misty. So I would like to take this opportunity to thank you for joining us today. If you think of a question later, please send over an email and I will make sure Misty gets it. And I don't think she would mind a short response. Perfect. Thank you, Misty. Okay, yeah, I don't see anything else coming through. So Misty, thank you so much for your time and for your information. And as I stated in the beginning of the webinar, we will send an email out, including the slides and the link to this recording if you would like to share it. Thank you so much for your time today, and we hope to see you next month. Bye, everyone.
Okay, thank you.